In this video, I'd like to talk to you about a substance known as N-nitrosodimethylamine, or otherwise known as NDMA, and how some people are unwittingly ingesting this on a regular and a daily basis in their pursuit of settling their upset stomach. Well, this particular chemical here has been found to cause cancer. It has been shown in the laboratory of rats and mice to develop huge tumorous growths. It's very toxic to the human liver. And as a matter of fact, only 2 grams of this ingested is enough to kill an individual over about a about a 48-hour period. As a matter of fact, back in 1978 in Oklahoma, there was an upset, jilted boyfriend who poured a small vial of this NDMA into the lemonade that his former girlfriend and her family were drinking, and it killed her and all of her family members as well. It's very, very toxic. As a matter of fact, there was a drug that was used for blood pressure medication, valsartan, I believe it is, and I think that it was being pulled off the shelves, but admittedly, I haven't followed the history of this particular drug. So if you are an individual that's taking blood pressure medication, and it is the valsartan or a genetic, I'm sorry, a generic knockoff of it, it would behoove you to go back to your prescribing physician and have a conversation about continuing to take this drug. What the Bloomberg report has found out is, because you may be asking, well, how in the world is this going on if they know that this particular compound is resulting in cancer or is a cancer-causing agent, and they're still allowing it to be ingested by the American populace? Well, according to Bloomberg, what's happening is many of the large pharmaceutical companies are using very cheap solvents in order to process the different chemicals that they use to make the pharmaceutical compounds. As a result of using these cheap solvents, one of the byproducts is the NDMA. It creates this as the byproduct, and as such, it's included in these compounds. Now, as I said earlier in this video, if you're one of those individuals that's been using a proton pump inhibitor, an antacid, or whatnot, in particular Zantac, you need to stop doing it, frankly, and you need to go back. If it is a prescribed medicament for you, you need to go back and have a conversation with your prescribing physician. The bottom line is this in all of this. The antacids, the proton pump inhibitors, all of the medicaments that individuals are taking for acid stomachs or the GERD or whatever nomenclature you might be using, it's not the problem that you're having, as I've talked about in previous videos, is not a result of having too much acid, but rather having not enough acid that's causing this distress that you're experiencing. So when you're taking the proton pump inhibitors like the Zantac, when you're taking the antacids, whatever it might be, all you're dealing with is the symptom. What you've got to do is, it would be like, putting a fan up to blow the smoke away and allowing the fire to continue to blow, or to continue to go on. What you want to do is put the fire out. That takes care of the smoke that's being produced. So get back to your doctor, have that conversation with him or her, and find out what's causing this problem that you're having, identify it, and get rid of it that way. All right. Look, I hope this information has been beneficial to you. And if you're not one that's using these drugs, but know somebody who is, you would be doing them a great service by sharing this information with them. And as always, if you have any questions whatsoever, please feel free to email us, and you can do so at office@pro-activewellness.com. We invite you to subscribe to our YouTube channel, Dr. Robert Bartosh, and thank you again for watching the video. And until the next one, and as always, God bless.